Welcome to the Department of Human Services webinar series, Strengthening Iowa's Childcare System. The series outlines the changes to Iowa's childcare system based on a federal law that was updated to include new requirements. This particular webinar is designed to cover the changes for registered child development homes in the state of Iowa. We will cover three main topics: background research on why these changes are important, information about the reauthorized federal law, and specific rule changes that will be happening for childcare providers. Additionally, there will be changes to the Childcare Assistance program, which will also affect childcare providers. There is a separate webinar that discusses these changes, titled Changes to the Childcare Assistance program. Please watch the webinar to learn about these important changes. Childcare is often the silent service in communities that allows parents to work or go to school. In the last 10 years, there has been considerable conversation and action related to preschool. However, the importance of quality childcare is also gaining more traction on the federal level, as well as in conversations in our state. For more than 10 years, neuroscience research in the area of brain development has identified the importance of the first few years of life. You, as a childcare provider, play a critical role in helping build children's brains by providing a safe, caring, nurturing, and engaging early learning environment. You likely already know this, but I want to recognize your role in building better brains in young children. To put it all in perspective, Iowa ranks number 1 among all 50 states, with 76% of households with young children under age 6 having all available parents in the household in the labor force. The national average is only 65%. Many of those children are cared for in home childcare settings. During the first 2 years of life, way before a child steps foot in an elementary school setting, 700 new brain synapses happen per second. The synapses connect the neurons in the brain. Since brains are built in stages, with more complex structures built on simpler structures, it is extremely important to build a strong foundation in the early years. Take a moment to think about the children you are caring for. What is the average amount of time a child is in your care? 6 hours? 8 hours? 10 hours? If we think about the 700 new synapses that happen per second in the first 2 years of life, if a parent drops their child off with you at 8 a.m. and picks the child up at 5:30 p.m., that child's brain has changed in almost 24 million ways during that time. Caring and nurturing early learning environments help young children develop social and emotional skills. These are skills like communication, problem solving, creativity, emotional control, critical thinking, teamwork, and ethics. In the workforce, these skills are referred to as soft skills or people skills, and employers are looking for employees with these skills. Childcare is also important to your local economy and our state economy. Parents need childcare to be able to go to work or to school, and employers need employees to be able to locate a business in a community. Now let's take a quick look at how we got to where we are today and the changes we are preparing for. On the federal level, Congress reauthorized or changed and updated a law called the Childcare and Development Block Grant. This is the law that gives federal funding to help low-income families pay for childcare and to improve the quality of childcare for all children. The law was originally written almost 20 years ago, and much has been learned about child development since that time. The changes in the reauthorization represent a paradigm shift for childcare in our state. The previous version of the law viewed childcare as mainly a work support for parents to participate in the workforce and gain economic stability. In the reauthorized version of the law, the purposes of the fund were expanded to recognize and include childcare's role in promoting healthy development of children in high-quality childcare programs. Iowa uses the money that we receive from this law for the Childcare Assistance Program, DHS regulatory staff that do monitoring visits with childcare providers, and for quality improvement activities for childcare providers, such as Childcare Resource and Referral, Iowa State University Environmental Rating Scale reviews, Quality Rating System bonuses, and childcare wraparound grants. As part of the law, Iowa submitted a state child care plan. The plan outlines how Iowa will meet all of the federal requirements. The Department of Human Services asked for public comment on the plan over many months, and the plan was submitted to the federal government on March 1, 2016. You can find a copy of the state plan that Iowa submitted on the DHS website. If you click on the Providers and Partners tab, there is a heading for childcare. Under the childcare heading, there is a link titled Reauthorization of the Childcare and Development Block Grant. That will take you to a page where you can view the Iowa Childcare and Development Fund state plan. You may have already seen some information about the reauthorized federal law and its new requirements in the DHS Childcare Newsletter. This quarterly newsletter is distributed electronically through our Childcare Resource and Referral partners. If you are not currently receiving that newsletter, call your local Childcare Resource and Referral agency and ask to be added to the distribution list. It is also important to get on the distribution list to get the latest updates, information, and resources for your childcare business. In the rest of this webinar, we will focus on 3 major areas of change that will be significant for child development homes. Major areas of change will include the Childcare Assistance Program, health and safety changes, and consumer education. Again, if you want to have more detailed information about the state's plan for all the changes required by the federal law, please refer to the state plan on the DHS website. Childcare Assistance is the name of the state program that helps eligible low-income families pay for childcare while parents are working or participating in education or training. The majority of the funding for this program comes from federal funds. There will be many changes to the Childcare Assistance Program in Iowa based on the new federal law. These changes include moving from 6-month to 12-month eligibility periods, allowing for temporary changes in work, training, or education activities, allowing for a longer job search activities period during the 12-month certification, a new exit eligibility program, and changes to reimbursement rates for some childcare providers. The webinar called Changes to the Childcare Assistance Program provides more information about these changes. Another area of change will be health and safety regulations. There will be changes to Iowa administrative rules for childcare programs as the federal law puts the health and safety of children as a high priority. The majority of these changes will take effect on October 1st, 2016. Let's take a little bit of time to review some of the most significant proposed changes, keeping in mind that this is an overview. DHS will share more detailed information about the administrative rule changes in the coming months once the rules are finalized. Starting October 1, 2016, anyone applying for a new child development home registration will be required to have a pre-inspection visit before being approved for registration. The pre-inspection visit will consist of key regulatory requirements that must be verified on-site before a registration certificate will be issued. Currently, only child care centers have a pre-inspection visit. Another new requirement of the reauthorized law is annual unannounced monitoring visits. This requirement is one that DHS has already been working towards, and in calendar year 2015, 98.6% of child development homes had an annual unannounced monitoring visit. This is the end of part 1 of the webinar for child development homes. Please make sure to watch Part 2 to hear the rest of the information about upcoming changes relevant to child development homes.